I'm excited about the new surgical center because of the opportunity it's giving to us as clinical officers. It's like a progression in our career. Also because of the big impact we have on the patients we have been having. We have been having a lot of difficulties providing care to the local people here, especially the maternity cases. Despite having the knowledge and skills to help them, we've been forced to refer them to the district hospital, of which there have been like delays that have cost babies' lives, mothers' lives because of the lack of space at the district hospital. We're about to demonstrate the flow of patients from the labor room to the OR. This is our patient Alice. She has tried to have a normal delivery, but it has failed, so we have called for a cesarean section. Now we are wheeling her out to the OR.
All right, Bridget. Patient's coming. It's okay, Alice. We got you.
So we are coming from the OR. We are going through the walkway and we are taking her into the cesarean section holding area so we can hand her over to the theater team. So when the handover is done, the maternity team can take back their stretcher back to the ward, and the theater team now has control of the patient, and we can wheel her into the OR. Our patient is being wheeled into the OR. She has been received by the OR staff.
And consented in the holding area.
Yeah, she has signed a consent form in the holding area. She's going into our room 1, which is for cesarean sections. The stretcher goes back to a cesarean section holding area. Whilst our anesthesia team is working on the patient, our surgeon is over by the scrub sink, scrubbing, preparing for the procedure. So once he's done cleaning, he will move into the OR and start the procedure. Once he's done, he maintains all aseptic techniques and walks into our OR. Our surgeons are done with the procedure. They are undraping the patient. It was a successful procedure, so now should be taken back to the ward. Once the procedure is done, the patient is taken for recovery to the post-op area. We the post-op area. So the staff will hand over the patient to the nursing team who will be monitoring the patient for the next few hours after the procedure until she's taken back to the ward. We have a patient who is coming in for an elective case. He walks through our main entrance and goes to the reception and gives his details so he can be directed on what to do. He is directed inside so he can be prepped. Once he's in, there will be demarcations for a private area so he can change into his gown and prepare for it. So once the patient has changed into his gown with drapes covering him to ensure his privacy, the doctor comes over to get consent and give him the specific details of his procedure.
All right. We're planning on taking out your appendix today.
So the doctor is going over to the locker room so she can change into her theater clothes, into her scrubs. So everything has been prepped. Our patient is waiting for the theater team to come take him to the OR. So she's out from the locker rooms. She's going to walk over to the scrub sinks so she can scrub for the procedure. So after surgery, everything has been done. The procedure was successful. The theater team is here to pick him up and take him back to recovery at the post-op area. Coming out now, going to the post-op area for recovery. patient has successfully reached the recovery area. This is our post-op area, so there will be drapes to make sure that he's covered, he has his privacy, as we also have another patient here, and the nurse station over here with all the staff that will be monitoring the patients up until the time they're taken back to the wards. So after the surgery, all the disposable stuff will be taken and thrown away accordingly, whilst all the instruments and tools that were used for the procedure will go for decontamination and sterilization, which will be shown. The surgical tools that need to be cleaned will follow the following course. We are walking down the corridor all the way to the sluice room. Dirty to a clean area, another clean area, passing through all the 6 steps up until the end where the instruments are the cleanest. Where they are the cleanest and the instruments are passed into the sterilization room. The sterilization team receives the clean instruments and the instruments are packaged. Once they are packaged, then they are autoclaved. Once they are done, they are taken into the sterile storage where they are in the storage area. They are put into shelves where they will be accessed whenever they are needed.
And we have 2 sterile storage areas.
Yeah, we have 2 storage areas. This is the first one and the second one over here.